Guess what state saw the biggest increase in COVID-19 infections yesterday? Yep, Texas. According to Johns Hopkins University, there were 7,621 newly confirmed cases of COVID-19 in that state. Why does that matter? Because earlier this week, Texas Governor Greg Abbott lifted the mask mandate there. Texas don't have to wear a mask if they don't want to, and said businesses could reopen 100%. In other words, a restaurant in Texas with a seating capacity of 50 can now seat 50. Mississippi also lifted some COVID-19 restrictions. Now, everybody who's been affected by COVID in some way, and that narrows the field to, everybody in the whole entire world can understand the desire to put this scourge behind us and get back to our normal lives. Everybody. But medical experts immediately denounced Governor Abbott's move, saying that it's too soon and could very well spur a fourth COVID surge. But not only the experts, infection preventionists and other healthcare professionals that we here at Infection Control Today talk to are also aghast by Texas. They are exhausted. They have been at this for 14 months. It looked as if we were going to finally put this behind us, and maybe these healthcare professionals could take the long vacation from their jobs that they so desperately and deservedly need. The 4 other states that saw a spike in COVID-19 cases yesterday, Thursday, include New York, 6,564, Florida, 6,014, California, 3,344, New Jersey, 3,691. Again, according to Johns Hopkins University. In the United States overall, yesterday, Thursday, there were 65,909 newly confirmed cases of COVID-19. And in the United States, 2,468 people died in the United States from COVID-19. Now, there are many moving parts. On the vaccine front, things appear promising. Mostly appear promising. The United States is now vaccinating an average of 2 million people a day. That's up from the 1,300,000 vaccines a day in early February. And it puts us on track to reach President Biden's goal of 100 million doses a month. So that's good. However, Nashville Public Radio is reporting that some batches of COVID-19 vaccine have been trashed, thawed, or have been allowed to expire. Not so good. By the way, I am Frank Diamond, the managing editor of Infection Control Today. We want to give infection preventionists and other healthcare professionals the information that they need to battle COVID-19. Let's step back a bit for the bigger picture. In the United States, there have been nearly 29 million confirmed cases of COVID-19. And in the United States, about 520,000 people have died from COVID-19. In the world, there have been about 116 million confirmed cases of COVID-19. And in the world, nearly 2,600,000 people have died from COVID-19. These stats, again, brought to you by Johns Hopkins University. Getting back to Texas lifting the mask mandate, health experts point out that there's still a lot that we just don't know about COVID-19. Not only about how it functions, the COVID variants are one of the reasons that medical experts say that now is not the time to step back from masking, hand hygiene, and social distancing. But we still don't really know everything that this coronavirus can do to the human body. The National Institutes of Health recently came out with a study that says that in some people, COVID presents such a challenge to the immune system that the immune system kicks into overdrive against this threat. So in effect, the immune systems for some patients actually starts to attack the patients themselves, according to this study. Dr. Kevin Kavanagh, a member of Infection Control Today's editorial advisory board, has been pointing that out all along, that we still don't know enough about COVID. In fact, Dr. Kavanagh has been ahead of the curve when it comes to weighing just what kind of threat COVID presents. He's been ahead of the Centers for Disease Control and Prevention, the World Health Organization, and most, if not all, medical experts. Yesterday, Dr. Anthony Fauci, President Biden's chief medical advisor, went on CNN to discuss the Texas situation. Fauci said it's not a good idea. He said that just pulling back on public health guidelines that we know work, and if you take a look at the curve, we know it works, it's just inexplicable why you would want to pull back now. That's what Dr. Fauci said yesterday. Dr. Fauci deserves every accolade that's been bestowed on him. He deserves the incredible respect he gets from the medical community. Not only just for how he's handled the COVID-19 crisis, but remember, Dr. Fauci first rose to international renown in the 1980s and the 1990s during the AIDS crisis. He's one of the people credited with turning a disease that was a death sentence into one that can be managed. And yet, Infection Control Today's Dr. Kevin Kavanagh has beaten Dr. Anthony Fauci to the punch every time during this COVID-19 pandemic. To take just one instance, Dr. Kavanagh called for universal masking a good month before Dr. Fauci and the CDC did. So here's a public invitation to Dr. Fauci. I know that every media outlet in the world wants a piece of you. I know your time is valuable, but only one media outlet, that's us, Infection Control Today, has Dr. Kevin Kavanagh, who has been ahead of you, Dr. Fauci, throughout this pandemic. So if somehow, some way you get to see this, I am inviting you on Infection Control Today to talk to Dr. Kavanagh about COVID-19. This will not be a debate. It will be a discussion that I hope helps illuminate aspects of this pandemic that haven't been illuminated before. I'll be the moderator, but even I know enough to stay quiet when brilliant minds are hashing things out. So there you have it, a public invitation to Dr. Fauci. Coming up, I will be talking to Dr. Kevin Kavanagh about what's going on in Texas, about the vaccines, and about the COVID variants. That's my conversation with Dr. Kevin Kavanagh, and that's coming right up. For these and other stories, please go to infectioncontroltoday.com. Earlier this week, Governor Greg Abbott of Texas lifted masking mandates in that state and had told businesses that they can open 100%. There was immediate blowback from some medical experts, including my guest today, Dr. Kevin Kavanagh, who is a member of Infection Control Today's editorial advisory board. Dr. Kavanagh texted me when that happened and saying just how bad of an idea he thought it was. So now I have you face to face, so to speak, Dr. Kavanagh. Can you talk to us about why it's such a bad idea?
Well, Frank, I think it's very problematic. Now, I need to state that predicting what this pandemic will do is kind of like predicting what the stock market will do. But we do have basic principles to follow in infectious disease. And right now, the rates have kind of plateaued, even in Texas, at a very high level. In Texas, the rates are approximately what they were in November of last year. Still very high, and they could be on the verge of just resurging now that we've relaxed our recommendations and what we're doing. You need to realize the rates did not go down because the virus decided to pack up and go away. The rates went down because people were following public health advice. So now that they are not following public health advice, the big question is, will we see a resurgence? Now, there are a number of caveats there, but there's also reason for grave concern. One is far too few people have been vaccinated, and we're now faced with a new variant. So even though you may have in Texas 5% of the people that have had both vaccinations, many more that have had at least one. However, with the UK variant that is 70% more lethal and 70% more infectious, it can defeat that. And we would be right back to where we were with another major resurgence, with other major episodes of hospitalization and death. And to me, I think that's just an unacceptable risk. On top of that, we also have the Brazilian variant and the South African variant, which are in the United States. We're not sure how prevalent they are because these variants require special testing or genomic sequencing, and we're not set up to do that, unfortunately. It's one of the shortcomings of the United States response to this pandemic. These variants may well defeat the vaccine and cause reinfections. We saw that happen in a Brazilian city, which I'm sorry for the pronunciation, but I'll pronounce it Manassas, which was in the Amazon, that had a huge spike, even more than the first initial wave that they had of COVID-19. And initially, they felt they had reached herd immunity with 76% of the population infected. And with the second wave, just dwarfed that first, both in deaths and cases. And so that they presume reinfections were occurring. So if that strain is prevalent, again, you may see a huge wave of reinfections. The other factor, which I have to have a word of caution, is we're really not sure what the performance of these vaccines are going to be with this United Kingdom and Brazilian variant. There is promising laboratory data on Pfizer and on the Moderna vaccines, which show that the majority of people will have protection against severe disease and hospitalizations and even deaths. But that's laboratory data. The only field data we have is with the Johnson & Johnson vaccine. That's a single-dose vaccine, and it looks like it may be protective against the South African variant. Initial data reported from the company found a 57% efficacy rate in their field testing in South Africa. And during that time, 98 or 95% of the cases were due to the South African variant. So this is really good. Now, this is just initial data. I can't tell you the details or for sure what efficacy means, but nevertheless, they have people data, not laboratory data, which I think is one of the reasons why they're trying to push the J&J vaccine, let alone its single shot and can have storage in a refrigerator as opposed to ultra cold storage. And I should also add that when you compare the efficacy between Johnson & Johnson and Pfizer Moderna vaccines, they were done at different times when different variants of this virus existed. So it's like comparing apples and oranges. So it's quite difficult to really tell you what's going to happen. But when only 5% of the people in Texas have had 2 doses of the vaccine, which would be either which would be either Pfizer or Moderna, that's not enough to protect against the South African variant, because laboratory tests show that there's a 3 to 6-fold decrease in activity against this variant using these vaccines. So the second dose is absolutely paramount to get that. Second dose gives you a 10-fold boost in antibodies, so a 6-fold decrease is probably manageable. Again, that's laboratory, not people data. So all of this is ill-advised. I don't know why, when we're on a winning track, would you want to say, hey, let's open up, let's not wear masks and see what happens. I think it's very irresponsible, because I can tell you, Frank, the governor cannot control the behavior of this virus, but he can set an example for behavior of people. And when the governor says it's safe, a lot of people believe that. And it might be safe, but it might also be very dangerous and very problematic. At the same time, as you know, schools tend to be opening, and it's just not a good situation. All in all, I would not have advised opening up the state and not wearing masks at this time.
Just to clear up one thing, the UK variant is 30% deadlier, or
Well, there's some studies feel that it's up to 70% deadlier. It depends what you read. Some say 30, some say 70. So if you say up to, the worst case scenario is 70.
Okay, yeah.
We don't really know until we see the data. One of the problems is that when you have more infections and you have more cases, sometimes you have then reduced capabilities of giving supportive care, so your fatality rate goes up. So the question is it going up because of the virus, or is it going up because our healthcare system is being flooded? That's kind of the case with the California variant, where they saw a 10-fold increase in fatalities, but it was at the time they were triaging care in California. Again, it could be due to the healthcare system being overrun. And so that really, when you look at what happens, being more infectious is worse than being more lethal, because infectivity increases the number of deaths exponentially as that virus spreads. Plus, it overruns our healthcare system, which decreases our ability to provide care. So yes, a lot of this is data which we are going to take probably months to years to hammer out. But what is known is these variants are more problematic, and they are designed by nature to try to escape our immunological response, which also gives them a leg up on escaping some of the vaccine protection. So this is not the time to be opening up. And I can't tell you whether or not the variants are in Texas and to what degree, because we do not have adequate genomic sequencing in this country, which is a huge problem. How can we make advice and how can we set standards and what we're going to do if we don't know for sure which enemy we're fighting? And that is inexcusable and a severe lapse of the previous year from not planning to get geared up to do this. As you know, there was ample controversy that was just, I think, inexcusable at discouraging just testing, PCR testing, let alone getting into the genetic sequencing of at least 5% of the samples. We're not set up. We're right now going blind. We do know, though, that we are up against a more lethal and infectious adversary, and whether or not we should be opening up, I would say no. Very problematic, unsafe. We just do not have the data to establish safety.
Yeah, I wanted to, when I heard you say 70% deadly, I didn't know whether you misspoke or I misheard, but obviously that's what you meant. I read the governor's statement, and what he said basically was, if you want to wear a mask, you can wear a mask. If you don't want to wear a mask, that's fine. Do you have any faith that by this point in the pandemic, people will, on their own accord, just wear a mask?
Well, I don't, because they trust their leaders. And when they're told that they don't have to, that's going to cause a large percentage of people not to wear a mask, which will defeat the whole purpose of trying to prevent community spread. Wearing the mask is just not to protect the individual, but it is to protect others. It is to try to drive down the infectivity of the virus to below zero, which can cause the epidemic to burn out. If you have a large number of people not wearing masks, it's not going to happen. And let's face it, the cloth masks, even if they're well fitted, are not as good as a respirator or an N95 mask. And to be optimal, both people have to be wearing it. And Frank, optimal doesn't mean safe. It means just safer. Ideally, people should at this time be trying to get either N95s or KN95s, which you can order from a reputable supplier over the internet. Granted, they're more expensive, but they give you much more protection. So opening up and telling people that they don't have to wear masks, not only do I think people aren't going to wear them, but they're probably not going to spend that extra money to get the better protective types of masks. And so, yes, it is problematic. Now, as I said, again, it's predicting what this virus will do is kind of like the stock market. But one thing which has happened is that in many areas, this virus has plateaued, and it has plateaued at a very high level. As I said, somewhat to where the cases were back in mid-November, before we had our holiday partying and surging from Thanksgiving to Christmas to New Year's. We have kind of come down from that. And that's, I don't think, is so much because we're defeating the virus, but we've changed our behavior. And so if we change our behavior back again, I think we're in danger of seeing another surge.
Are you worried that other states might follow suit? I know Mississippi sort of has done the same thing.
Well, I think so, yes. But not only that, the types of coverage that we're seeing of what Texas is doing and other states are tending to relax and open up their state, I think that will also encourage other individuals, even if their state hasn't opened up, to be more relaxed and not follow guidance. Again, we need to have consistent messaging from our leaders to get people to follow guidance until we get people vaccinated. I mean, we are so close to getting vaccines out to people and getting them fully inoculated. And that, I would suspect, would result in a very large and substantial decrease in cases. We are so close to doing this. Why abandon now when we're just starting the vaccination process?
What about the people who have been laid off and are struggling to pay bills? I mean, I can understand on a human level where they're willing to risk it, but I understand that if they could just hold on, you say what, maybe another month or 2 months till more people get vaccinated, then they should be able to get back to normal.
Well, I'm not sure it's going to go back to normal, but being laid off isn't dependent on whether or not you have a mask to use at work.
Right.
I mean, work needs to be safe. It needs to have increased air filtration, air sanitization, increase in complete air exchanges. Workers need to have N95 masks or respirators, especially if they have a lot of contact with the public. That right now can be done. It's just having the employers spending the resources to provide a safe workplace. And if it's not done, employees can order an N95 mask or a KN95 mask themselves. Granted, it's extra money, but it can be done. And I think that it's very sad. It's a sad commentary on our society that we haven't provided more worker protection, more worker benefits during this pandemic. We've expected them to provide needed services, to be frontline workers. We have given them minimal protection for aerosolized spread. And if they develop COVID-19, they maybe get 2 weeks of sick leave. But if they become a long hauler, they are in severe lasting trouble as far as finances and employability for the rest of their life. So it is not a good situation. We need to do more for our frontline workers. At this point, we should have abundant masks and safety equipment for our workers.
Dr. Kevin Kavanagh, as always, a fascinating discussion. Thank you for joining us here today at the Infection Control Today.
Thank you very much, Frank.
And now back to you, Gina.
Excellent. Thank you. Let's turn things over to Psychiatric Times. Take it away.